The European Union has decided that cancer will be one of the main areas of work of the Union in the next few years. President of the Commission, Dr. Ursula von der Leyen, has made a very clear statement about this to her colleagues, and especially, of course, to Stella Kyriakides, the Commissioner for Food and Health. We have already started working on this in Europe before the new Commission started to work through what is called the Cancer Mission, which is delineating some areas that should receive some priority for the next few years and receive, of course, funding to work on these priorities. That development is going on quite nicely. There is the Cancer Mission, led by Professor Walter Ricciardi from Italy, with many representatives from various areas dealing with cancer. And they are held by an entity called the Assembly that has convened with them recently and has just been asked to review the second draft document. And the deadline is actually on April 3rd, the time in which I'm recording this message. So within the next 2 to 3 weeks, we will have some further news from the Cancer Mission. In parallel to this, and be reassured, in constant communication with the Cancer Mission, there is the European Beat Cancer Plan, which was launched in Brussels at a very important meeting where I would say almost everyone who deals with cancer at high level was present and listened to Ursula von der Leyen, Stella Kyriakides, and others on how the Commission is looking at this situation. This work is going forward, unfortunately slowed down by the impact of COVID-19, but continues to go on. And the ECCO, the European Cancer Organization, is among those that is working very closely, both with the Cancer Mission and the Assembly, and of course with the Commission. And we recently had a very nice meeting with the persons from the Director General that is helping the Commissioner, and Mr. Matthias Schuppe gave us some further information on how things are moving, and this information should be available on the website of ECCO. As I mentioned earlier, unfortunately, the whole world is facing this pandemic called COVID-19. Of course, our thoughts go immediately to those who unfortunately died, to their families, and especially to all healthcare workers that have, with remarkable courage in countries which were unprepared, dealt with the situation. Unfortunately, most of the European countries have had time to prepare themselves and should have a lesser impact, but nevertheless a terrible impact because of this disease. And I'm also thinking of the countries that are not as fortunate as we are, where we know that there are situations which are basically humanly unbearable. But within this context, we have to realize that our duty as ECCO, the European Cancer Organization, which represents 28 cancer organizations and 18 patient groups, is to think first of our patients. And many of our organizations have put forward messages on their website, contacted their members in order to tell them that while it is true that the patient that is under active treatment for cancer, especially with chemotherapy or chemoimmunotherapy, are at a high risk of complications, those who have had cancer at a certain time ago, except some very special cases, where the long-term immunity might have been decreased, like patients who have had transplantations, for example, are not at a higher risk of a complication, but everyone should follow the directives in his or her country that the government has enacted. And personally, I believe that the first directive is clearly the one of stay at home if you only can, and be careful. Don't approach people, however dear they are to you. If you are not living together with them, keep them a certain distance, because you never know who is carrying the virus. This has also had consequences, this crisis, on the fact that many of our societies have had to postpone their meetings. And for some of our societies, these meetings are actually revenue generating. And this was the reason why, while understanding the major issue, which is the one that we have to protect all citizens in Europe, we also have to think of the fact that some of our member societies are now in dire financial situation. And we have therefore mentioned to the authorities in Europe that beyond all the support that is going to be given to all societies in Europe, they should not forget these whose members are usually volunteers dedicating their time to improve the outcomes of cancer care in Europe, and that these merit some support if they really go into a major financial crisis.